Moving and positioning risk assessment. So training aims and learning outcomes for participants to understand the LITE risk assessment and to apply it in practice. Participants will be able to explain what the LITE risk assessment is used for. They will also be able to state what LITE stands for and to explain what part of the risk assessment each letter covers. Risk assessment is a process whereby someone identifies a hazard, assesses the risks that hazard presents. So once that is established, we can then work out ways of reducing the risk that hazard presents, and then we'll monitor and control. And it goes around in a cycle. So this is essentially identical to the nursing cycle that you may be familiar with. So in regards to moving and positioning service users, we use a specific risk assessment framework, which is called LITE. So each letter represents a certain aspect that of the movement that needs to be assessed. Hazards in regards to moving and positioning could be things such as lighting, noise, cables, etc. And each of these hazards that are identified will have a probability of causing or contributing to an undesirable outcome, so harm to either a service user or to staff members. So the LITE will be used by staff every time they move and position a service user, but it will also be considered when care plans are being produced by more senior staff members or registered nurses. And it is a risk assessment that aims to make the moving and handling of service users as safe as possible. We cannot make it 100% safe, but we can try and make it as safe as it possibly can be. And the LITE risk assessment is an essential part of that. So LITE stands for load, individual, task, environment, and equipment. So the load will be whatever object or person that you are moving and positioning. Individual means the staff members that are assisting the movement of or positioning of the load. The task is the actual job itself. So, for example, hoisting a service user from the bed to their wheelchair. Environment is for example the bedroom and all the risks and hazards within that environment. Equipment is whatever's used to move and position the service user, such as the sling hoist. So this LITE risk assessment will be performed every time by the staff members before they move the service user. So I have another video where we talk about the 7 safe principles, and the first principle is stop, think, plan, and assess. So during that first principle, you're going to be doing the LITE risk assessment as part of your thinking and planning. So you do this right at the beginning. So the first thing you look at is going to be the load. So it's going to be predominantly you're going to be moving a service user. So you want to look at all the hazards and risks that the service user themselves presents. So this could be a whole range of things. So it could be their behavior or potential behavior. So are they going to exhibit challenging behavior during the movement? Are they going to become aggressive, either verbally or physically? Are they going to understand your instructions? Could they misunderstand them, become confused, and do something that is not safe? So maybe they put weight on one side of their body that can then lead to them falling or injuring staff members. If it's their behaviour, maybe if they're being physically aggressive, then that could lead to an incident, them falling, or you're not checking the sling is attached to the hoist properly. It could be that they're visually impaired, hearing impaired. It could be that they have hemiplegia, where they're paralyzed on one side of their body. It could be a lack of adequate clothing. It could be that they're very heavy. So the list is almost endless. So you need to just have a good look at them, assess them, and then identify these hazards and the likelihood that they're going to cause harm. And then at the same time, try and work out creative ways of trying to reduce the risk that these hazards present. So, for example, if it's challenging behavior, maybe you don't move them at that time. Maybe you come back to them at another time. Maybe you wait for any medication to take effect. Maybe you change how you're communicating with them. Maybe you give them more time to do the movement. So maybe this is ways that you can reduce the risk from challenging behavior. You may just not be able to move them at all because their behavior is too dangerous. So you work out ways of reducing and eliminating the hazard. So once you've looked at the load and worked out ways of mitigating the risk, you then move on to individual. So you look at the staff members. So certain hazards and risks are going to be if the staff hasn't had training in moving and positioning people, if that training isn't up to date, if it's not been sufficient, that could be a risk. It could be the staff members' state of health, if they have an injury, or they're intoxicated, or they're just not well enough to be working. This could also be a risk. It could be that they're not wearing the appropriate clothing, inappropriate footwear. It could be something simple like hair not being tied back, and that becomes a distraction to them. Attitude, it could be their attitude. If they've got a bad attitude towards moving and positioning, that can be a risk. So you need to, again, the list could be almost endless. So you just need to assess what the risks and hazards are, and then try and work out ways of reducing the risk. So if it's, for example, like a new member of staff, they've just done their moving and positioning training, and you're also a new member of staff who's doing moving and positioning with them, it probably would be a safer situation if the staff were mixed up in their experience. So you'd have a more senior member of staff working with junior staff, for example. So you try and work out ways of reducing, eliminating the hazards and risks they present as you're going along. Once you've done the individual, you'll look at the task itself. So let's say it's like hoisting from the bed to the wheelchair. So you'll want to consider things such as the number of staff that are necessary. So hoisting from the bed to the chair. So the best practice is at least 2 members of staff, but it depends on the policy in your work area, and it depends on what has been assessed for that individual service user. So it may be appropriate for one member of staff to assist a service user with a sling hoist transfer, but best practice would be 2. You may need more. You may need 3, 4, or 5 people, depending on the individual service user. So you can look at staff numbers here. You can consider time. Do you have enough time to do the transfer? So you don't want to rush it, because if you rush it, you're going to cut corners, you're going to make mistakes, and that could lead to an incident. If it's the very first time you've hoisted a service user, you don't necessarily know how they're going to react. You don't know, like sling size, for example. So maybe you have an additional, more senior member of staff to supervise. Maybe you allocate more time. You can also consider the time of day as part of your risk assessment. What you're actually doing is you need to see if it's actually necessary. Have you got the correct equipment for it? So this would all come under the task. Next, you'd have a look at the environment. So you want to have a look at space. So more space is always better, but you need to try and create space. Look at the lighting. So you need to have appropriate lighting to do the movement, not just for your own vision, but for the service user's vision, who might have a visual impairment that's significantly affected by low levels of light. So you have to have the lights on in the room. Think about noise levels. So you need to be able to communicate with the service user, but also other members of staff present, and you don't want any distractions. So maybe the television's very high in volume because the service user has a hearing impairment, but maybe just for the movement you're going to put it on mute, so it's not causing a distraction or a communication problem. You can think about privacy and dignity here, so whether you need to close the curtains or not, screens or doors closed, etc. Maybe going outside of the facility, you can consider the weather. Is it appropriate to go out to a certain location on a certain day? Does the location you're going to have disability access? You can think about animals, so pets visiting the service user, or pets that the service user has. Maybe do they need to leave the room? Are they going to cause a distraction or interfere with the movement? Maybe there's service users' relatives or friends present in the room. Maybe they could leave to make more space. So this is the environment, and then we move on lastly to equipment. So you want to check that the equipment is suitable, it's appropriate for what you're doing. It needs to be, if it's a sling hoist or the sling itself, it needs to be inspected by an appropriate person every 6 months under the LOLA guidelines. LOLA regulations. You need to think about the safe working load of both the sling and the sling hoist. You need to make sure that you have the appropriate size sling for the movement, and that will be your responsibility as a person about to transfer that service user in the sling hoist. Is your responsibility to ensure you have the right size sling for that individual. So you'll need to make sure it's the right size there and then, regardless of what the care plan says. So you need to do all your checks on the equipment and make sure it's safe and appropriate to be doing the movement. So that's the lighty assessment. So before you actually move someone, maybe you could do it 30 seconds in your head. When you're writing care plans, you need to consider this lighty. And it will not make things 100% safe, but it will make things safer. And and it can become quite extensive. But that is the Lighty risk assessment for moving and positioning people.